Hello and welcome to the MDS podcast, the official podcast of the International Parkinson Movement Disorder Society. I'm Alfonso Fasano, professor of neurology in Toronto, Canada, and I'm the guest editor for this new special series on tremor. Today, we are very thrilled to have here as a guest Professor Elan Louis from UT Southwestern in Dallas, Texas, in the States, who is here with us for the very first episode of this series, and the title of this episode is Why Tremor? Thank you, Elan, for having accepted our invitation.
Thanks very much, Alfonso. Happy to be here.
Thank you. So let's get started. And I would like to really start with the question, why tremor? Why do you think it is important to talk about tremor?
Tremor is one of the most common neurological disorders. It's among the most common movement disorders, and it affects millions and millions of people, not only in the United States where I am, but across the world.
Indeed, it is very common, and you've done a lot of work in trying to understand the epidemiology of the disease, particularly essential tremor. Can you give us a flavor of how common it is from a number perspective?
Sure. So we know from population-based studies that 90 to 95% of normal individuals have a clinically evident tremor on examination. That would be considered a normal tremor. But as far as abnormal tremors go, essential tremor is the most common of these. And we know from epidemiological work that in the United States, for example, there are about 7 million people with essential tremor, which represents 2.2% of the entire US population. Globally, when you look at people over the age of 50, it's about 4 to 5%, and it goes up each decade. So by the time people are in their 90s and older, estimates are that as many as 20 to 25% of individuals have essential tremor, making it extremely common.
These are remarkable numbers. And I'm sure you agree with me, though, that in spite of this very high prevalence, not many patients end up being seen by a doctor, not even a movement disorder neurologist, but even just a family physician or a general neurologist. Why is so?
I'll just elaborate on the last point a little bit as well, that we were talking about the prevalence of the disorder, but in terms of the incidence, that is, new cases arising each year, again, in the United States, the estimates are that about a third of a million new cases arise each and every year. So that's close to 1,000 new cases arising every day. But getting back to your question about why we don't see all these patients in clinic, and that's because the tremor can range in severity from mild to very severe, and many of the cases in the population have early and or mild essential tremor. And the estimates are that anywhere between about 10 to 15% of patients that are seen in population-based studies end up coming to medical attention. So we're just seeing a fraction of these patients.
And do you think that the overall understanding of the public opinion on tremor is good enough, or for every person out there with tremor, the only thing that they're interested in is ruling out Parkinson's? So if there's a good understanding of what tremor is.
I don't think there's a great understanding in general about tremor in general, or about essential tremor more specifically. I also think many individuals with this have other explanations initially. Maybe they think they're drinking a little too much coffee, or maybe they think they're a little nervous, or maybe they think it's a medication that they're taking. People will try to find rational reasons for why they're shaking more. And if you can find a reason for why you're shaking, you don't need a doctor to tell you why you're shaking. And so you don't necessarily come into medical attention.
Absolutely. So a lot of people actually seek for their own explanations on the internet, which is very dangerous. But more generally speaking, if we looked at tremor, and yes, essential tremor perhaps, in the general adult population, can we look at it? This is a question that I'm always trying to find a solution to. Can we look at tremor as an overall sign of brain frailty, something that is cooking? Because we know that some of these patients, as you showed, end up having Parkinson's disease. So can we look at tremor as a general and specific sign that something is off?
And here, just to clarify, we're talking about tremor in general, or we're talking specifically about essential tremor?
Given the prevalence that you just outlined, even if we say tremor in general, I guess we need to refer to essential tremor, although as some epidemiological studies have found enhancement of physiological tremor as the most common problem. So I would say let's lump them together for now and let's have a conversation about it in tremor, essential tremor, enhancement of physiological tremor. In other words, I'm 60 years old and I start having a mild postural tremor. It doesn't bother me. But do you think it's going to be interesting to neuroscience to look at these patients carefully because this is going to indicate that something is wrong with their brain, and this may be the beginning of a dementia or Parkinson's, or the tremor might be like that forever? What's your general idea about this?
Right. So the first consideration is looking at that tremor and seeing whether that meets criteria for essential tremor, which is a disease or a family of diseases, as opposed to just a normal condition. Because if 95% of people in the population shake, by definition, that's a normal condition. It can range in severity. Some people can have more of that normal condition and some people less. But you want to see whether you're dealing with the approximately 4 or 5% of people out there in this age group who have what we call essential tremor. And yes, I think it is very important to determine that because not only does essential tremor have its own natural history, and we know that it worsens over time. So this will be important for patients to know as they consider treatments over time. But we also know from epidemiological studies that it appears to be a risk factor for other degenerative conditions like Parkinson's disease and dementia. So I think it's important to know from multiple perspectives. And given the fact that it's often a familial disorder, it becomes an important question for families to know about. Do we have something in this family that we're all at increased risk for that is potentially disabling and associated with other conditions?
Well, and touching upon what you just said, the familial tremor, I heard that some people don't look for medical attentions because, oh no, this is something normal. Everybody in my family shakes. So they don't even perceive this as necessarily a problem. I don't know whether that's really the case, especially for those high amplitude kinetic tremor. But that aside, and obviously if you want to comment on that, it's fine. But the question I have is, we know that this condition, let's talk about essential tremor in this case, is highly inherited. So there is a high proportion of people with at least another family member and with the same problem. And we also have large pedigrees sometimes. And in spite of that, it's so difficult to find genes. How can you reconcile this?
Right. So I think when I first became interested in essential tremor, and this was in the mid 1990s, the idea back then was that it was highly inherited and that it was an autosomal dominant condition. And I think just given the experience of many of us who've been looking for genes for the last 20 years, is that we've come to the conclusion, firstly, that it's less inherited than we thought it was. And secondly, that it's not often or less often simple Mendelian genetics and more likely complex genetics with probably multiple genes, each having a very small effect. Although, as a field, we haven't had a lot of success in terms of identifying those genes in more than one or two families. So there's still more work to do. And we are in a similar situation to autism or schizophrenia, where clearly there's a familial contribution, but we're having difficulty finding what those genes are.
You got the multiple contributions. I agree entirely. And actually, you briefly mentioned the beginning of your career. And one thing I was particularly interested in asking you today, which I asked, I don't know if you remember at some point when we were having a conversation during a meeting, is the following question. You've been working on this for many years. You published hundreds of papers on tremor. Why did you get interested in tremor?
I got interested in tremor almost by accident. My mentor and advisor asked me to look at a simple question that related to tremor, which was how often it runs in families. And I told him that everyone knew that 50% of cases were familial. And he suggested I look into the literature. And I looked in the literature and I found two things. Number one, that the data were low quality and all over the place. So that value of 50% was probably not a valid one. And secondly, there were so few studies of essential tremor in general that any direction that you turn in, there are questions that are unanswered questions, whether it relates to the causes of the tremor, the genes, environmental factors, underlying pathological changes, natural history. Anywhere you turn, there are unanswered questions.
Yeah, very interesting. And this overall emphasizes the role of mentors. A lot of the listeners of the MDS podcast are trainees or young movement disorder specialists. And I think this is a very important message that just by chance, just because you met one person, your mentor, that one day asked you a question that you thought it was an easy answer to give, that profoundly changed the rest of your career. And this is really the power of mentors. So that's why I'm really glad that you shared this experience with us. Talking about the role of mentors and educating on tremor, do you think that more neurologists or even more disorder neurologists should be interested in tremor?
I think everyone should be interested in tremor. And I think all movement disorder neurologists are interested in tremor to some extent because you really can't be a movement disorders neurologist and not take care of patients, whether they're essential tremor patients or Parkinson's patients or patients with dystonia. These all have tremor, right? You have to be. But as a central focus, I think more and more people are interested in it now than in the past. I think that as we fill in more and more of the blanks, there is more for people to be immediately interested in and fascinated by. And so I think we see those numbers increasing as we advance our knowledge.
Now, that's very good to hear. And do you think this is paralleled by an increase in funding? Because I don't know if there's enough attention from an economic standpoint when it comes to tremor.
There are, in terms of NIH, there's a relative paucity of studies on essential tremor with the rise of neuromodulation, which I know is very near and dear to your heart, that many of the publications that relate to essential tremor and now many of the funded proposals center around the role of neuromodulation in essential tremor. That has increased the number, but in terms of non-neuromodulation, the number is still quite small. I think with associations between essential tremor and dementia and Parkinson's disease, I think the number will likely go up because this adds an additional dimension to the study of essential tremor.
Yeah, I will agree entirely with what you just said. Maybe the only exception to the non-neuromodulation piece also gaining attraction and interest is the focused ultrasound option that has led many patients to go seek for medical advice. And in my experience, actually, I found that many of these patients don't even have tremor. They have any sort of disease from myoclonus, or many have functional tremor. And I know that this mirrors your experience. Moving on to another question I have for you. I have just two more. You've been very kind in sharing your time with us. One question is, what do you think are the most important discoveries in tremor research? If you look back at the past, I don't know, 20 years, where does your mind go to the question, what is the most important discovery or the most important discoveries in this field?
Well, I think that there are several areas of knowledge that have advanced. One of these is when I entered the field, essential tremor was really just viewed as and regarded as almost just a symptom, almost just a physical examination finding. And now we have a really enhanced understanding of the clinical features and natural history of this disorder. I think everyone in the field agrees that there's considerable heterogeneity, and how we deal with that heterogeneity is a topic for debate and discussion and controversy. So I think there's a richer view of the disease, or I think probably a family of diseases themselves. And that's been a big change. The other is that 20 years ago, we really didn't know where in the brain essential tremor was coming from. There was a hypothesis put forth that it related to a physiological dysfunction coming from the inferior olivary nucleus. But when one looks more critically at this, it was based mostly on animal studies that were not even directly relevant to the human condition, essential tremor. So we've really gotten to the point now where we understand the central role that the cerebellum plays in essential tremor. And back then, there had been very few autopsies. I could count the number of autopsies back then on both of my hands. And now we're at the point where we're dealing with an order of magnitude more. We're dealing with close to 300 autopsies. And we've gotten to the point where we've identified degenerative changes in the ET brain, numerous of these, and to the point where we can take an ET brain at the time of death and a control brain and tell the difference between the two with 95% accuracy. So having this understanding of the tissue-based changes that occur in patients with the disease then opens the door to understanding the pathophysiology, which then opens the door to more targeted therapies, which we both know we need to do a much better job at devising better therapies for this disorder. Coming back to the start of our discussion, why aren't there more patients coming into clinic? I think one of the reasons is also that the treatments are limited. And so patients might come to clinic once or hear about others who come to clinic and know that the success rate of the current treatments is pretty modest.
Absolutely agree. Thanks for this. And my last question that builds on what you just said, because you gave us a perspective of the past 2 decades. The question is, where do you think this field is going?
I think that this field is now heading in a direction where scientists are beginning to think on a more serious level about what the underlying causes are, and that the seriousness of research is on par with the research that occurs with respect to disorders like Parkinson's disease and Alzheimer's disease, other neurodegenerative conditions. So I think it's very hopeful in that regard. And I think the types of research that are going on will increasingly enhance our understanding of the disorder. I can see now, for example, in the last several years, the number of medications or potential medications that are under consideration by pharmaceutical companies has really expanded considerably. And I think a lot of that is, again, just based upon our enhanced understanding of the disorder. So I'm hopeful that the pharmacology will get better, and that will keep pace with all of the advances that have occurred over the last several decades in terms of neuromodulation therapy, which I would say has been another major change in the last 20 years.
Thank you, Elan. These were great insights. This was the first episode of the podcast on tremor. You just heard from Professor Elan Louis from UT Southwestern in Dallas, Texas, in the United States. This episode was Why Tremor. Once again, thank you, Elan. It was a pleasure to host you here.
Thanks very much, Alfonso.
The views and opinions expressed by the participants in this podcast do not necessarily reflect those of the International Parkinson and Movement Disorder Society or their affiliated journals, Movement Disorders and Movement Disorders Clinical Practice. Any disclosures of the participants can be found within the episode description located on the MDS website.